Hello, my name is Lindsay Willis and I will be performing my physical assessment with Miss TW here. She's going to be my patient for today. So when I first go into a patient's room, I go in and I assess their skin, their general appearance. So I would say that her general appearance is her grooming is appropriate for age, her dress is appropriate for age, for being at home. And then you would assess skin tone. Her skin tone is even and consistent with her genetic background. It's like a pinkish tan color. I don't see any redness or swelling. No cyanosis, which is like a bluish tint. No jaundice or yellowish tint to the skin. I would go in and say that her temperature is even, not too hot, not cold, and that it's equal bilaterally. She doesn't have any diaphoresis. Her moisture is dry. And then I would say that the texture is smooth, and you would go in and assess for skin turgor right at that collarbone level. And it's within normal limits. It's got good elasticity. The skin is firm. And then you would test and look at her fingernails, if you can give me your fingernails. She does have acrylic nails, so you would just look at the nail bed. She doesn't show any signs of clubbing. The angle is at that 160-degree angle that it would be considered normal. Can't really test for the cap refill of the nail, but you can do the blanching of the skin right under the nail, and the skin blanches and is returned to normal within that 2-second mark. So after that, you would go to the head and face. Her head and scalp is normal cephalic, and there's not any contusions, masses, lesions that are noted at that scalp level. Then you go in and you would assess for the temporal artery. So you would do it on both sides, right above the cheek level, right at the eye level. And you can feel it and assess it. And they're even bilaterally. And after you check for the temporal artery, then you would check for the temporomandibular joint, which is right at that cheek level. If you could open your mouth for me and then take it back. Okay, perfect. Don't notice any crepitus or any limitation of movement when she does that. Did you have any pain or tenderness doing that?
No, ma'am.
Okay. After you do that, then you would go and test for the frontal sinus and then the maxillary sinuses. So you would put slight firm pressure at the eyebrow level. Any pain or tenderness when I do that?
No, ma'am.
Then you would do it right above that cheek. And then I don't feel any swelling or pain when I put firm pressure on that. And after you do that, then you would test and look at her neck. So you would make sure that her neck is supporting her head and she's not experiencing any pain when she does that or lag on one side. So then you would go in and you would test for the cranial nerve 6, which assesses the shoulders. If you would, just shrug your shoulders. Perfect. Good. So she doesn't have any limitation of movement whenever she does that, or one side is experiencing any lag than the other. Then you would take a look at her trachea. Her trachea is midline. No swelling noted. After you look at the trachea, then you would palpate for her thyroid. Anterior approach, you would just take your thumbs on both sides and just move the thyroid back and forth. I don't feel any masses or swelling to the thyroid gland. And then you would come to the posterior side. Are you able to kind of turn your head a little bit to the right? No, your neck. And you would palpate here. And I don't have any masses or swelling when I do that as well. After you do the neck, then you go to the eyes, and I'm going to pull down on the conjunctiva. Conjunctiva is pink, doesn't show any blue, yellowing, or white, which would be dry, normal moisture to the eye. You look at the sclera is white and round. I don't see any cuts or busted blood vessels within the eye. The cornea is smooth and round. Iris is within normal limits. And after you assess those things, then you would get your pen light out and you would assess for the pupillary eye reflex. So if you would look at me, please, even on. Perfect. And then just look right here for me at my finger. Okay, and then pass my shoulder, please. But look dead on. There you go. Awesome. So then you would say that her pupils are equal, round, and reactive to light and accommodation. And then you would take your ophthalmoscope and you would test for the red reflex in her eye. After you do the eyes, then you move to the ears. With the ears, you would look at the external opening of the ear on both sides. There shouldn't be any redness, swelling, or drainage noted. And you would come over to the other side and do the same thing, and I don't see any redness or swelling. You would pull the pinna up and back and move the tragus. Do you have any pain when I move that?
No, ma'am.
You come on this side and do the same thing.
No,
There shouldn't be any tenderness. After that, you would take your otoscope and you would check inside of the ear and check for the tympanic membrane. There shouldn't be any blockages or anything that would be within the ear. And then after that, you would do the whisper test. So you would go behind each ear and say a word and whisper it.
Pearl.
Okay.
Red.
So she has patent hearing. It's within normal limits for her. So after the ears, then you would go to the chest and you would assess for how she's breathing. So just breathe normally for me. So she doesn't have any labored breathing. So then you would go and start, you would check for symmetric chest expansion anterior and posteriorly. So you come down. Okay, take a deep breath for me. Perfect. Symmetric movement on both sides of the chest. And you would take this in. Perfect. And you would do it on each side. And then you would also test for tactile fremitus, which is palpating as you go down. And if you would, please say blue moon.
Blue moon. Blue moon. Blue moon. Blue moon.
And you should feel that vibration as she says blue moon. And then you come to the back side posteriorly and you would test for symmetric chest expansion. Perfect. And hers are equal and within normal limits bilaterally. And then you would go in and palpate, so say blue moon for me.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay. And then after that you would also percuss. And you're percussing for resonance, hyperresonance, and with her she has resonance in the lung fields. And then you would listen to the back side to make sure it matches the front side. Perfect. after you do that, you would just make sure that she didn't have any adventitious breath sounds. Hers are within normal limits. She's not experiencing any shortness of breath just sitting here. It's very even and regular for her. Then you would move on to the cardiac portion of the assessment. So with cardiac, you would find the apical pulse. The apical pulse is going to be on the left side, and it's going to be the 4th intercostal space, midclavicular line. So you would come and you would listen for that heartbeat. Right. And then you would listen to the heart valve. So you would start with the aortic valve, which is on the right second intercostal space. Pulmonic, which is on the second left. And then tricuspid is the left lower sternal border. And then the mitral is the 4th intercostal space. So after you listen to the heart valves, then you would move on to the abdomen, and if you would just lean back for me. And you would look at the stomach. The stomach for her is flat. After you assess the stomach, you would just make sure that there weren't any masses or lesions or bruising of any kind. And you would listen to the bowel sounds. You would start in the right lower quadrant and make your way over to the left lower quadrant. And she has regular bowel sounds. She doesn't have bulborgamous or hyperbowel sounds. They are within normal limits. And then after you do that, you would listen to any vascular sounds. For her, she shouldn't have any vascular sounds noted. You would start up here where the aorta would be. And then you'd make your way down to the renal. And like I said, you shouldn't be hearing any sounds. In the iliac. And then femoral. Well, I think I hear something. No, she does not have any vascular sound. So after the abdomen, you would have her test her musculoskeletal skills. So you would ask her to stand up. And when she stands up, as you notice, she pushes off with both arms. It wasn't any limitation on one side or the other. She's standing on both legs equal. She's not showing any weakness to one leg or the other. And she's able to fully use her full range of motion. Alrighty, you can sit back down. Those were my knuckles. Okay, after that you would test for neurological. And if you would close your eyes for me. And this is for the cranial nerve 5. Do you feel anything there?
Mm-hmm.
Feel anything there?
Mm-hmm. Mm-hmm.
Perfect. And back to the mouth, because I did miss the mouth. You would look at her lips. Her lips are not cracked. They're pink. You would have her open her mouth for me and stick out your tongue and that. And then you would look at the back. And she's got her buccal mucosa is pink and smooth. There's no any cuts or masses noted to that cheek area. Her teeth are intact. There's no cracks. Gums were pink and had moisture to them. Her uvula and tongue were midline. Tonsils, the tonsils are present. They haven't swollen, so they would have like a grade of about 1+ for her. And then you would take a tongue depressor and then you would pull down on that soft tongue and test for gag reflex for the cranial nerves 9 and 10. And then you would have her stick out her tongue and say ah, which would test for the cranial nerve 11. And you would just also look at her soft palate. They should have that rugae there for her. And you would also test under the neck portion, just the cervical lymph nodes. They shouldn't be swollen, but palpable for her. And you would come all the way down. And that is my physical assessment. Thank you for this semester, and thank you for being my patient. And thank you, Dilly, for deciding to perk up in the ending of my assessment.